And let's shift focus to news from the down south. This is coming from the state of Kerala, where first case of Nipah virus has been reported. In fact, Health Minister Veena George has also issued a statement confirming that 14-year-old boy from Malappuram district has been tested positive for Nipah infection. The National Institute of Virology in Pune has verified the diagnosis, with the boy currently receiving treatment at a private hospital and is scheduled to be transferred to Government Medical College in Kozhikode. A team from Australia is also set to visit India today to treat the 14-year-old, is what we are getting to know. So concerns mounting over the Nipah cases in the state of Kerala. It's the first case that has surfaced. The boy who's been tested positive. Meanwhile, samples of his family members have also been sent to determine whether others in his family are also positive for Nipah virus. Let's listen in to that statement that's coming in from the Kerala Health Minister Veena George.
We had a meeting here. Honorable Minister, who is in charge of Malappuram district, he also joined the meeting online, and we had here MLAs and additional chief secretary was there, the district collector, district police chief was there, and all our senior officers, state officers also participated in the meeting.
And let's go across to Ashwin also, who has the details. He's joining us from Thiruvananthapuram. Ashwin, that's the first case that's been confirmed by the Health Minister herself. Take us through the details of this case.
A 14-year-old boy, Samiksha, has now been diagnosed with Nipah, and the boy hails from Pandikkad in Malappuram district. And now the whereabouts of this boy is being looked. There is a route map that is being traced also. Meanwhile, Australia has sent the antibody, which is called as monoclonal. This has been sent from Australia, and right now the boy is being treated at the Kozhikode Government Medical College, at the same medical college where back in 2018 there were the first case of Nipah virus was diagnosed. In fact, in 2018, 17 people had lost their lives, including a health worker by name Lini. Back then there was less arrangement, but this time the health department has made all the necessary arrangement. In fact, a 60-bed isolation ward has been completely set up by the health administration, taking in case the fatality ratio as well as the ability for the particular virus to spread through people's contact. So right now the tracing of the bodies, of the boy's route map, basically where all the boy has went in the last few days and his family has went, all this is being done, and meanwhile the medicines also is arriving. At the same time, we also needs to put it out that the health minister is there monitoring the situation on the ground. At the same time, we get to understand is that the family members who are the primary contacts with the boy are being tested. The health workers who had treated the boy in the private hospital. In fact, he was earlier in a private hospital. The TrueNat test in the private hospital as well as the test made by the Kerala government, both had turned positive, and later a sample was sent to the Pune Virology Institute. Even that was found positive. Now, in this regard, all the primary contacts with the boy is being right now being tested for Nipah positive. Test is being conducted. At the same time, many of them are being isolated as well. What we also get to understand is that the district of Kozhikode is also on high alert. Remember, Samiksha, ever since the Nipah outbreak that happened in 2018,
yes,
till now there has been 19 deaths. There has been 5. This is the 5th outbreak, in fact. The first outbreak in 2018, in 2019, in 2021, and in 2023, where 2 lives have been lost as well. So totally 19 lives have been lost. Around 700 people altogether have been tested in the past for Nipah positivity. In fact, there was a special team which was set up by the Kerala government to study the bats also, and what they found that 20% of the bats that they collected from their survey, 20.9% of the bats' saliva had Nipah virus. So certainly it's a cause of concern that has been there, but at the same time, the Kerala Kerala government is working very cautiously and with high alert and putting all the system in place. There's a team of doctors that has also been put up in place. The expert doctors who have faced Nipah outbreak in the past, all of them are there at the forefront to ensure that the disease does not spread to large number of people. Precautions have been put in place as instructions have been stated, given that all the health workers in Kozhikode Medical College will have to wear the PPE kit from today.
All right.
Samiksha.
All right, Ashwin, thank you for the moment. So, Ashwin, they're getting us details of the case. Definitely a case of concern. Given that Kerala has a history of fatal Nipah cases. In fact, let's take a look at this report, which has details of this case. We also understand in the latest that a team from Australia will also be arriving in Kerala today to treat the 14-year-old who's been tested positive for the Nipah virus.